Murimu wa COVID-19 riu otambite matura-ini ma kaunti 44 otigatu kaunti cia Baringo, West Pokot na Samburu. O ni kuringana na CAS wa ugima wa mwiri Rashid Aman uria ugite kuri na Kenya maregete gwathikira mawatho na mitaratara ya kuhurana na gutamba kwa murimu wa COVID-19. Guku akiririkania a Kenya ati dawa ya murimu uyu ndirironeka, arauga mitaratara iria yaniriirwo o kabere ya gwithamba moko, gwikunika manioro na kanua na kuraihaniriria noyo ikuguna bururi ihinda-ini riri.
Our peak is likely to come in probably late August, early September. That is the working hypothesis that we have now.
Rashid augite uriri kwiyongereire arwaru angi 418 muigana wa arwaru goko bururi-ini riu ukihinga 13,771 andu angi 4 ni makuite na gukinyithia muigana uyu 238. Ona gukire uguo andu 498 ni mahonete, hari aya 465 ni aria makoretwo makihonera micii-ini.
That home-based care doesn't mean that we put somebody in a home-based care and then they are forgotten there. These individuals are monitored through the system of healthcare workers that we have, particularly the community health volunteers who have been trained and who work with communities, who keep an eye on them.
And any who develops symptoms in the course of the follow-up is admitted into healthcare facilities. We have not recorded any deaths therefore so far from our home-based care protocols.
Ihinda-ini riri ruhonge rwa ugima wa mwiri rugite uthuthuria no urekwo wa kuonania kana mundu arwara rita rimwe no acokererwo ringi ni murimu uyu, na oho kumenya kana kuri hindi miri ikahota gwitiria murimu uyu ona hatari dawa. Ngiribotera Inooro TV, Getwo Karo Kenyugo Mwaura.